So the next speaker really needs no introduction. So please join me in welcoming Dr. Governor.
Jesse Lasovich and start being a Juris Doctor or a lawyer certainly doesn't count. But it's great to be here with the Butte Silverbow healthcare community who sees daily the impact of tobacco on their patients, but also sees daily the impact of what Medicaid expansion has done for this community and indeed our entire state. And going last after these fine professionals are batting cleanup a little bit. In many respects, they said most of the things that we all need to carry from this. But I want you to get your head around the fact that over $12 million has been spent already flooding our TVs, stuffing our mailboxes with fundamental misinformation. One of these companies has spent more than 3 times the total amount any ballot initiative committee has spent to oppose an initiative in our state's history. Get your head around what $12.5 million in Montana really is. We talked about 100,000 Montanans having health care. They have spent $125 per each of those people trying to take their health care away. And fundamentally, it is time, from my perspective, to stand up to the tobacco companies. And let's talk a little bit of truth about what I-185 really does. Because what you're seeing or hearing or reading is in so many respects false. First, I-185 fully funds the state's share of Medicaid expansion, Medicaid coverage for 100,000 Montanans. And it was said before, 4,000 in this community alone. The vast majority, when you look at national surveys, 8 out of 10 of every individual on Medicaid in the expansion population are working. These are working folks that need health care at the end of the day. So that's not one more of the basic needs they have to be concerned about. Of those 100,000, 65,000 have accessed preventative care, not waiting until they are so ill to come to the emergency room when many times it's too late. Let me say that again, though, it fully funds the state's share of Medicaid expansion. Completely funds it in total. So the idea that there's some unfunded mandate out there is sheer baloney. Second of which, it will also help reduce smoking and fund other essential services that veterans and seniors and others have earned and deserved. I think they did a great job, Dr. Yates did, of talking about and caring about smoking cessation. The idea when you're a junior in high school or even younger, what an increased costs will do from preventing them from ever taking that first step. I-185 will raise the tobacco tax, which we know will also help then reduce smoking, which is the #1 cause of preventable death in Montana. And with I-185, if you don't smoke or chew or vape, you're not paying a thing. And we can hold tobacco corporations accountable for the nearly $800 in taxes that every household in our state is paying right now for tobacco-related illnesses. I-185 will also help preserve health care for all of us, especially folks living in rural areas of our state. We're a state of 147,000 square miles. Anybody that's either from a rural area or regularly travels there, you know that if you lost that health care center in that community's gone. States that didn't expand Medicaid have a 6 times faster closure rate of rural hospitals than those that did. In Montana, we haven't lost a one of them. Uncompensated care costs in our state dropped nearly 50% since we expanded Medicaid. That's what's helping to keep the doors of those rural hospitals open. And because we expanded Medicaid, our uninsured rate went from 20% before to 7% today. Our economy also benefits from I-185. One of the many things I love about this town is if a new employer was going to come and it brings 5 people to it, everybody would say, this is wonderful, we're creating jobs. Since expanding Medicaid, over 5,000 new jobs in our state. $300 million of new personal income. And don't kid ourselves, if we didn't expand Medicaid, it's not like you'd all get a check back from the federal government. We'd be paying to have health care in places like New Jersey and others. That's money that has come into our state as a result of us providing health care for another 100,000 Montanans. And our veterans and our seniors benefit from I-185. Ballot initiative creates new revenue to provide much needed suicide prevention support to our veterans and to help fund the Veterans Nursing Home right here, and I see Senator Sesso in back. Nursing home services, yeah, right here in Butte. But let's clear the air about this as well. Some folks say that, oh, this new thing, it's capping the money going to veterans. Don't kid yourself, this is $2 million new money going to veteran services each and every year. $2 million that won't be there if we don't pass I-185. You're not capping the money, you're providing a new funding source to provide veteran services and services that they've earned and they deserve. If you look at that 100,000 population, folks that have expanded Medicaid, almost 10% of 9,500 are veterans, service members, or their families. Not everybody that wore a uniform is VA eligible. And many people in areas of our state, it's too darn hard to get to a VA center. 9,500 of those that are part of our Medicaid expansion population served our country by wearing a uniform, our family members who have. Plain and simple, from my perspective, I-185 assists, provides much needed support to veterans. It will also help fund in-home care for our seniors. Unlike those big tobacco companies, though, that we don't have unlimited money to spend. And don't kid yourself, big tobacco companies aren't spending out of their big tobacco hearts for the betterment of us all. They're there to protect their profits. They're there to keep that stream of income coming from not only those that have smoked for years, but that new crop of kids that they see as a possibility to get addicted. We may not have the unlimited amount of money, but we certainly have the facts and the support of doctors, of nurses, of hospitals, community health centers, of business leaders as well, saying what a meaningful difference this makes. Folks have recognized what a difference Medicaid expansion makes and the importance of continuing to fund it. And recognize also that last legislative session, combined with the record fire season, strained our health and human services budgets. It impacted people in communities large and small across this state. If the money doesn't come in to fund those services, what I-185 does is pays for that. We can expect much more of the same, unfortunately, when we go into this next legislative session. So I think that we have the facts, we have the support, we have the knowledge. Sometimes it becomes so abstract when we talk about 100,000 Montanans. But recognize these are our friends and our family members. These are people that we see at the grocery store and the church. Some of the most profound moments of my time in service as governor have been when somebody walks up to me on the street and literally says, here's what happened when I got health care. Recognize that when we talk about mental health challenges, how many more folks have treatment for mental health? Substance use disorder, addiction, it opens up opportunities for folks all across our state. At stake is 100,000 Montanans receiving health care today that wouldn't necessarily without I-185. At stake is 9,500 veterans and their families who could lose their health care. At stake is the opportunity to prevent thousands of premature deaths caused by smoking and to make tobacco companies pay their fair share for their deadly products. So we have about 4 weeks from the election, and from my perspective, we need to continue to have these conversations. It's not television commercials that vote. It's not mailboxes that vote. And they may well spend even more money trying to confuse folks about what this initiative would do. It's up to us to ensure people understand how important I-185 is to our livelihoods, to our healthcare system, to our economy, to our veterans, to our senior citizens. Voting for I-185 is not only the smart thing to do for our state, but it's also certainly the right thing to do. So thank you for both hosting this, thank you for all being engaged in this, and most importantly, thank you for recognizing that we can clear a lot of this smoke out of the air and talk about what this will actually do for veterans. Sure appreciate it. Are there any questions? I have an answer, maybe.
I think I might